I've been healthy in my entire life, no problems with anything, until 2007 when I was diagnosed with Parkinson's.
Tom's Parkinson's disease progressed quickly, bringing with it severe and uncontrollable shaking and flapping of his arms. These involuntary movements left Tom unable to work, to drive, even to feed himself.
I was on a number of medications. We probably went through about 7, 8 different medications and different dosages, and it just wouldn't do anything for me. No benefit at all. Tremors were taking over, and I had no choice. Either I'd have something done or I'd be in a nursing home. That's the best way to say it.
Hi.
How are you today?
Great.
Desperate for an answer, Tom came to the University of Michigan, where the unique multidisciplinary Surgical Therapies Improving Movement Program, or STIM, is bringing hope to some patients with severe movement disorders not helped by medication alone.
Movement disorders are a collection of neurological disorders that are caused by problems with a particular structure in the brain called the basal ganglia. For essential tremor, medications can be very effective, and up to about 70% of patients will respond to one of our top-line agents. For Parkinson's disease, the medications that we have can treat the symptoms very, very well. As the years go by, unfortunately, it does progress and symptoms get worse. And what patients find is that the medications stop working quite as well. When the medications don't work adequately or when they stop working, we often offer a procedure here at the University of Michigan called deep brain stimulation.
Deep brain stimulation is essentially a brain pacemaker. It's a thin wire electrode that gets placed very precisely into the brain and produces electrical signals. So in your brain, there are electrical signals moving around all the time. And when a patient has a disease like Parkinson's disease, those electrical signals get disordered. The wire goes in, it creates an electrical signal, and that acts kind of like a metronome to keep the brain in order.
The comprehensive program offered at U of M involves careful pre-treatment testing and planning to determine which patients may benefit from this highly complex procedure.
Deep brain stimulation surgery is a procedure that occurs in 2 parts. The first part is the placement of the electrodes, and the second part is the placement of the battery or the pulse generator. So the first part, the placement of the electrodes, is done with patients awake. The reason that it's done that way is that way the patient can be tested in the operating room to see whether the leads are placed correctly to affect their symptoms.
There are several ways that we can confirm that the electrode is placed correctly in the operating room. One of the unique features of our program is that I, as a neurologist, am called into the operating room to test the electrodes once they're put in. By testing it, I turn them on, I set them at clinical settings, and we see if any of the symptoms are improved. And if they are, then that is a guarantee that we are in the right place.
The second stage is the placement of the battery, and that's done with the patient asleep. And what we do is we then connect a wire from the lead that's in the brain to the battery, which is located here in the chest, and connect down between the two.
A couple of weeks after the surgery, we bring the patient back into the clinic, and that's when we turn the stimulator on. Okay, well, let's check your stimulator now.
It was instant, like turning on the switch. If it weren't for the deep brain stimulation, I wouldn't be sitting here. My arm would be fine. I'd be sitting in a nursing home. My voice caught a little bit in my balance, but I'll give that up for what I have.
There you go. For the well-selected patient who's been chosen by a multidisciplinary group and tested carefully, deep brain stimulation can transform their lives.
I'm still able to drive my hot rod. It was a big boy toy I decided to buy when I found out I was going to have deep brain stimulation. That's my reward.